Hello all, today the topic of discussion is cervical cancer. As you all know, we celebrated January as Cervical Cancer Awareness Month, and the theme for this year was to learn, prevent and screen for cervical cancer. So to learn is to educate yourself with the causes and symptoms of cervical cancer. Cervical cancer is the leading cause of cancer in women, the second most common cause of cancer in women, and it is caused by human papilloma virus. And this papilloma virus is not only responsible for cervical cancer but also for the vulval, vaginal, anal cancers in women and also penile cancers in men, and it is the most common cause of genital warts also. So how to prevent it? As you all know, vaccination is the best protection. Who should get vaccinated with cervical cancer vaccine? Any woman between the age group of 9 years to 45 years are eligible for taking cervical cancer vaccine, and the schedule depends upon the age of the woman. In between 9 to 14 years the schedule is 2-dose schedule, and above 15 years it is a 3-dose schedule. And vaccination gives almost 97% protection from cervical cancer and 100% protection from genital warts. As you all know, early vaccination gives you the best protection, so take it as early as possible, and better late than never. So when to get screened for that? Any woman, irrespective of vaccination status, should get screened with cervical cancer from the age of 30 years, and the further schedule depends on the findings of the present test. And what are the most common symptoms of the cervical cancer? During the initial stages there cannot be any signs and symptoms, but those women with increased vaginal discharge, foul smelling vaginal discharge, irregular bleeding, weight loss, loss of appetite and low back pain should get screened for cervical cancer.